Okay. Good afternoon. I'd like to welcome you to the Senate Special Legislation and Veterans Affairs Committee meeting. This is the first meeting of the Veterans Affairs Committee. Usually on an annual basis, we ask the Director of the Veterans Affairs to provide us with an update relative to the Veterans Home, the Veterans Cemetery, Rhode Island serves, and also on their annual report. I'm glad to see that Director Hawkins is here to also provide some assistance, and want to recognize the new members to the committee, Senator Lawson, Senator Bell, and Senator Mendes. And welcome at the old members that we've had previous years. Senator Murray, Senator Morgan, Senator Raptakis, and Senator Seveny. Our clerk is Caitlin McCanner. You see her on the screen. And our attorney is Kevin McHugh. I see him on the bottom over there. McHugh. If you have a question relative to the process today, just please raise your hand. That way I can recognize you, because it's our first meeting, and again, it's touch and base because of the fact that usually I would be at the State House conducting the meeting, but because of the inclement weather, I'm trying to do it from home. So the gist of the meeting will be as the agenda stated. I'll have the director speak for about 5 to 10 minutes, give a synopsis, and then we'll go through each of the different categories on the agenda and be able to ask questions on those. So without further ado, Director, I'll turn it over to you.
Thank you, Chair. Chairman Felag, distinguished members of the Senate Committee for Special Legislation and Veteran Affairs, thank you for the opportunity to provide you with an update on the work that our Rhode Island Office of Veteran Services is doing to serve our veterans and military families. Joining me today also is our leadership from Rhode Island Department of Human Services. Director Hawkins, thank you, ma'am, for joining me today as well. In my opening remarks today, I'm going to cover 4 distinct areas, as the chairman had mentioned. Our COVID-19 response efforts regarding the Veterans Home, our cemetery, our Memorials Veterans Cemetery, our Rhode Island service work that we're doing, and also today's due today, and each one of you should have an electronic copy of our annual report. And I will walk you through each one of these in my opening remarks here today. So let's get started. We are at work with partnerships across federal, state, and local government boundaries to include our veteran, military service organizations and nonprofits. Together, we strive to have every veteran walks through our doors. And as this past year, when we said that, every veteran, be it called us, FaceTime, Zoom, WebEx, Microsoft Teams, Adobe Acrobat, have connected with us, of course, based on the guidelines from our Rhode Island Department of Health. So to say 2020 was an unusual year is, of course, an understatement. We have faced reality, we all have faced the reality of navigating the uncertainty and anxiety related to this COVID-19 global pandemic. Our agency has worked relentlessly to adapt to this ever-evolving environment, and through it all remain unwavering in our commitment to our veterans and military families. Under the Office of Veteran Services, we have distinct 3 lines of effort. Our Rhode Island Veterans Home in Bristol, our Rhode Island Veterans Memorial Cemetery in Exeter, and our Veterans Resource Center, home of our Rhode Island Service Network, in Warwick. Each plays an important role in the work that we do on behalf of our veterans and military families. Let's take a quick look at the COVID response efforts at the Veterans Home. Take a look at some of the data. Our Veterans Home serves as a testament to our state's appreciation for all of our Rhode Islanders who have served, and our General Assembly's support of the men and women who live there, as well as our staff who work there every day, is appreciated. We remain steadfast in our commitment in providing residents with an environment that is safe and healthy. We work hard to keep COVID-19 at bay, resulting in the fact that the Veterans Home remained COVID-free through much of March and April 2020. Sadly report that we have been not untouched by this pandemic, and we've lost 9 Rhode Islanders, the finest and bravest men that you want to meet, that served this blessed nation of ours, that died due to COVID-19. We've also had 39 residents and 99 staff members that tested positive over the duration of this pandemic. But I am pleased to report to you at this time, no residents have tested positive in the past 3 weeks, and only 1 new staff member had tested positive in the last week. The uniqueness of the neighborhood design in itself and the establishment of a dedicated quarantine and isolation unit has helped us slow the spread of the virus within the building. We've established health and safety measures for quarantining and isolating those positive residents, while allowing those residents who have not tested negative safely be able to access other areas throughout the facility. At the beginning of the outbreak, our team consisted of the Governor's Office, EOHHS, DOA, HR, OMB, DHS, Providence VA Medical Center, our federal VA partners, the Rhode Island National Guard, and Rhode Island Department of Health have collectively got us to this point. So, and another thank you to all of my colleagues for supporting this effort. As the Vice President of the National Association of State Directors of Veteran Services, I directly oversee 12 other states that make up the Northeast District. Our ability to share information, discuss effective practices, and has been a key capability in our overall COVID-19 response efforts. We continued social interaction, keeping our residents connected with family members and loved ones while following the social distance guidelines and recommendations from our Rhode Island Department of Health has been our highest importance. Facilitating these events were largely carried out by our social worker staff and activities personnel who have become experts at Zooming, Skyping, FaceTiming, and even more. We continue to keep our family members and residents informed in a timely manner. Our Veterans Home Administrator provides weekly updates via letters to the family members. We hold Zoom calls. As a matter of fact, I just finished up a Zoom call, a monthly call with the family members. That is so important that we set up a venue to allow them to get asked any questions that we may have of us, because we know that there's miscommunications out there. So we allow that opportunity to listen directly to our family members to provide us feedback and to act upon some of those things to clear up some of those type of misconceptions that are out there. We're happy to report that 3 of our neighborhoods are open for visitation. And of course, the virus dictates the narrative and our approach to how we can administer the visitation policies in place. But we try to do, again, our utmost priority is safety. It's paramount for both our residents and, as I said before, our staff. As a part of the pharmacy partnership in the long-term care program, CVS has provided on-site vaccination clinics for our residents and staff. 96% of our residents have received the first dose of vaccination. Of those, 98% have been fully vaccinated. 63% of our active staff have received the first dose of COVID-19 vaccine. 86% of those individuals have received the second dose. Our leadership continues to be encouraged by our resident staff to take advantage of the COVID vaccine that's offered to them. We expect some vaccine rates to increase as those staff members vaccines at community-based clinics over the coming weeks and months. Our number one priority continues to be health, comfort, and safety of the men and women who've chosen our Rhode Island residence as our home as their place of residence and for our staff. This is a valuable experience. We entrust that we only care for them, but to build that level of trust. In 2020, we discovered an error with our collection of our maintenance fees. We were flagged that. We thank our community partners for flagging that, to bring that to our attention and bring it to light. As of January 15th, 2.3 million of the 4.9 million has been refunded to those reimbursed. We are following the reimbursement order that we outlined in the corrective action plan that both Director Hawkins and I have signed, and continue to provide monthly updates to our federal VA partners. We are planning to continue to outreach those impacted by this, next of kins, guardians, power of attorneys, and executors. While COVID-19 has not left us, we're not trying to declare any type of victory laps whatsoever. But we know we do, so with the surveillance testing that we're doing twice a week, with the vaccine process, and as we the ability to quarantine and isolate to identify it early on, has put us in a good place. And I got to admit this, that we could not be here without the hard work of all the team members on the team that I have mentioned before, like the DHS's, Department of Health, our VAs of the world. So again, thank you for that teamwork effort. Regarding our cemetery, it serves as a dignified, solemn place for our veterans and their eligible spouses and dependents who represent our everlasting appreciation for those that served our country honorably. We average approximately 100 interments a month. The Veterans Cemetery remains one of the busiest in the nation. During fiscal year 2020, the cemetery conducted 1,185 committal services. Our staff consists of 16 employees, 12 of which are full-time, 4 are seasonal staff. The Rhode Island Office of Veteran Service conducts an annual Memorial Day observance at the cemetery against the backdrop of our World War II memorial. In 2020, we had to change it a little bit because of due to COVID-19 restrictions. We also had to change our impact the way we delivered our program for Reach Across America as well because of the pandemic. Lastly, I want to talk to you a little about our resource center, the third line of effort. It's our coordination center for our Rhode Island Service platform. This is the nation's first statewide referral network. Launched in 2017 through the hard work of Chairman Felag, it addresses the number one challenge facing Rhode Island veterans, navigating the myriad of resources and available services. With Rhode Island Serves at the forefront, our statewide reach, Rhode Island veterans and their families now have a better way to access the benefits that they've earned through a no wrong door approach to serve our veterans. And because of this pandemic, if it wasn't for Rhode Island Serves, we will not be able to deliver that high level of care for our veterans because of this pandemic. And so Rhode Island Serves has been a game changer and continues to be a game changer in our state. So we start to look at the data regarding RI Serves. We've managed over 2,600 cases for our veterans and military families, connecting them to various service providers out in the community. Together, we have over 155 partner providers in our network addressing the number one challenge facing our veterans, benefit navigation. Every day, our case managers work with our Rhode Island Service partner to coordinate care, resources, and services for our veterans and their families in all the various service areas. In each case, each works towards a simple solution to match the veteran with the right service provider at the right time. This past year, we've serviced over 526 requests that came through our Rhode Island Serves door. There are veterans, military members, their families. This has been a phenomenal program for the state of Rhode Island. With our focus on value, credibility, and collaboration, we're able to make the network as suitable and viable for our veterans whenever the needs arise. Use the system now, we can hold each other accountable, formalize communication, coordination, and transparency to better serve those who we serve. More importantly, Rhode Island Serves fills the gaps of those underserved in our community and allows us to work together as a team to ensure positive outcomes to make sure that no veteran and their military family falls through the cracks. Lastly, our annual report. This is today, and I'm pleased to report. Thank you for your service, and also each one of you should receive an electronic copy of the annual report as well. In it, one of the highlights I want to talk about the mental health piece. This is a topic that's near and dear to my heart, and it's okay not to be okay. 6 years ago, Governor Mondo's Overdose Prevention and Intervention Task Force started the mission to destigmatize mental health, substance use, and the community partners to work together and to serve in a greater capacity, to only serve those who we serve. And I present to you that annual report for this year. And again, so Mr. Chairman and honorable members of this committee, on behalf of Director Kasim and I am now will turn the floor over to you, sir, for questions any of you may have.
Thank you very much. We did receive a letter from the Italian-American war veterans, and some of it I may go through. Some of it I'm going to ask you, Director, to meet with that organization and see if we can clarify some of the concerns. it's a little difficult here for me to go back and forth and to try to figure out all the questions. Obviously, this committee is not involved in any fiscal analysis. There's three members here that are part of the Finance Committee. We will go in depth those particular items of concern of that organization, but we can talk about it generically in terms of different aspects. So the first thing I'd like to focus in on would obviously be the Veterans Home. You've given us numbers in terms of vaccination and testing that's being accomplished there. I guess the major concern is visitation. How do we stand on visitation, and when do you see visitation opening up for the veterans upon completion of the vaccination?
Yes, sir. Visitation, the virus dictates the narrative for that. So what we've done when we first started back in April and March of last year, we were testing once a week, both we were testing the residents and the staff. And based on the positivity rates, that dictates the narrative if we're going to have visitation or not. And so we were going for a while. We had visitation going till we first started to see a couple cases that popped up. And in conjunction with consultation with the Department of Health, we had to cease visitation. Then as we tested and we realized where we are regarding the number of infection rates, that dictated our ability to do either visitation or not. And while the times that we weren't able to do visitation, we used things like FaceTime, social media to connect the family members with the residents. As the virus progressed, we were able to do, again, through partnership with Rhode Island Department of Health and DHS, we were able to start the visitation process. And being mindful that while we're doing the visitation, we're also testing the staff and the residents. And if we, in any cases of positives that came out of that based on the end of that test, that will restrict visitation. So where we are today, we've done another round of testing for 3 consecutive weeks. We've not had any new cases, only one staff member who's been quarantining. So we've started to open up the visitation process. Right now, 3 of our neighborhoods, visitation is allowed, and visitation is coordinated, has to be prearranged, coordinated, and following Rhode Island Department of Health guidelines in terms of the social distancing as well as duration of the time to which you can do your visit. We're mindful of end of life type of issues, and we coordinate directly with the family member and our staff to work through the visitation process also. We utilize the capabilities of keeping our family members informed through various letters that the administrator does at the end of every week, to include having monthly Zoom calls with the family members to actively listen to them to clear up any type of questions. Visitation, as a matter of fact, today, Chairman, visitation was one of the number one topics, along with vaccination process, that the family members had raised to us in that regard as well. But partnering with them, to communicate early and often the visitation requirements is a testament to the hard work the team is doing.
Follow up on that is, do we have a way of allowing those patients that maybe not computer savvy or Zoom savvy to assist them in corresponding with their loved ones?
Yes, sir, absolutely.
The next question would be, and again, if any member has a question, please raise your hand. I'll recognize you. But one other question relative to the internal workings within the veterans home. Are the patients able to move from room to room, or how isolated are they, or how much open space can they move from one place to the next?
Yes, sir. The virus dictates our ability and the ability when we're doing our testing on what we can and cannot do in that capacity. For example, our residents, so we do the surveillance testing twice a week. At the end, we get the results. And based on that, where we are in the process, for example, Kasim lives in neighborhood C. Kasim takes his test. If he comes back negative, okay, that means just part of it, because we are in a neighborhood type of setting. The key is to how did I test, and to include the other neighbors in my neighborhood testing, and basically get to clear the test, and that enables us as a neighborhood to release those restrictions, and we can leave our neighborhood, and we can, in a coordinated way, leave our room, leave our neighborhood, and go across to outside to utilize the facility, for example, the common area.
Senator Bell, you had a question?
Yes, thank you so much, Chairman. And thank you, Director Yarn, for the work you've done. First of all, I do want to start on the positives. You know, compared to some of our neighboring states, although there is no acceptable death rate, our numbers have not been as tragic as they have been in terms of the percentage of residents who have passed away in some of our neighboring states. And in fact, compared to the percentages of residents who passed away in other congregate care settings in Rhode Island, it has not been as bad, and I think that that is excellent. However, there has been a sort of a dark side to that, is that one of the things that was done, I think partially to achieve that, is that new entrances were shut off, and the census has dropped, and the waiting list is now quite long. And you know, at my community meeting this weekend, one of my constituents, who's a veteran, brought up the ongoing crisis of homeless veterans, which is a huge crisis in our state and across the country, but in our state. And one of the concerns I had is that, more broadly, the budget proposals that we have seen around the Veterans Home have consistently pushed for cuts, including some cuts I felt were very cruel, such as garnering the wills of veterans who die intestate, raising fees, cutting physical therapy, and requiring people to travel outside the home to receive those services. And consistently, we have seen the Veterans Home not overspend its budget in times when overspending is necessary to achieve the adequate services that were budgeted. And I'm particularly concerned about that during COVID. So I'm hoping that you could respond to and perhaps explain your failure to adequately overspend your budget during these times, and the way in which sometimes, in fact, reductions in services were turned to rather than overspending, and whether you would commit to introducing budget proposals that, rather than proposing further cuts, propose an increase in services on the scale necessary to meet the crisis of homeless veterans in our state.
So thank you, Senator, for those comments. And so I'm going to try to break it up into buckets. And so to address the homeless, we know one veteran's homeless is one too many in their capacity. We use our capabilities. So regarding being mindful of the tax steward for the taxpayer, we use our grant funding that the General Assembly had provided to the sum of $200,000 to distribute out work with our nonprofit organizations that are doing the work in the community to address the homeless need in our state as well. And we also leverage the capabilities of our federal VA partners also to provide those various services. We participate in weekly data calls regarding the homeless folks in our community to address their needs. To include, we're doing work regarding our Department of Corrections, those veterans that are inmates that are coming out of that system within 12 to 18 months in that capacity, bargaining together with other colleagues in state government to address that issue. And so, you know, budget is a continually juggling in terms of priorities in that capacity too as well. But I've asked my team to continually take a look at these things to address these issues head on as early as humanly possible, to get in the decision makers' hands, to the governor, and also to provide input to the General Assembly as well.
Through the chair, if I may.
Yes.
And thank you, Chairman. And so thank you, Director, for that response. You know, I do have to say I am concerned about the way the process is being used here. I heard you expressing a concern for taxpayer money, which is a concern I understand. But I really believe that fundamentally the role of an agency is to present the budget that's necessary to achieve the services that we have a mandate to achieve, in this case federally as well as morally. And I'm concerned that some budgetary decisions are being made that are more the place of the General Assembly. If we don't have the ability to find the funding That's one thing. But I'm concerned that in some cases, the department is making decisions about lack of availability of money that's really our prerogative to make. And as a result, some cuts have been made that I don't think would be cuts that we desired. And we had a lot of concern about this, much discussion during our Senate budget debates in the past about the impact of cuts at the Veterans Home that came in the proposal, and they were not cuts necessarily that the General Assembly had imposed ourselves. So I'm concerned that some of the decision making is being made at the inappropriate place. And I would urge you perhaps to consider allowing us to make the decision of whether or not the funding can be achieved, rather than prejudging that in terms of your budget proposals going forwards.
Thank you, sir.
Getting back to the Veterans Home, and I'm glad Senator Bell brought up some of those issues that need to be addressed because, as you stated, we want to provide the best we can for our veterans. They deserve it, and they should be fully funded. We've heard a lot of rumors relative to the 100% to 80%. We've heard rumors relative, or actually, what is our status relative to our occupational and physical therapy?
So, for regarding our budget, I'm not aware of any type of that type of line item in our budget. That our budget, when put it together this year, was not that the 80 to 100% did not go into consideration whatsoever. Number one, regarding our overall budget process too, we're still in the process of submitting that through. I understand it's due in March timeframe. Regarding that line item, sir.
Again, in the budget process, who's going to be submitting DHS or your budget? Is it going to be the current governor or the lieutenant governor? Have we come to grips with that yet?
No, sir, I'm not aware. I'll let Director Hawkins speak to it for the DHS side.
It's to be determined still, Senator.
Okay, because a concern that a lot of people have expressed to me has been the staffing issues. And what is our solution going forward to that staffing issue? I think it's imperative that we have permanent people there so we don't have to worry about a field or a team and supplementing people in on weekly basis.
I totally agree with you, Senator. And to that point, Chairman and Director Hawkins, why Director Hawkins on me as well. We talk about this on almost every meeting Director Hawkins I participate in. The number one question on that story is regarding staffing levels. We know that this virus has directly impacted our staffing levels, but that's in unison with all the nursing facilities and assisted living facilities across the state, because on some of to utilize the utilization of agency staff, we all rely heavily upon that too, and of course is at a cost associated with that as well. In order to be competitive, to utilize agency in that capacity. To your point, Chairman, though, we understand too the need for, and that's been the number one question that I know your constituents have been reached to you, sir, because you flagged me on multiple occasions, and I had it today regarding that family members on that call earlier regarding staffing levels in that capacity. The number one issue is staffing levels. It's a continuing juggling act, but I tell you, I can't ask for a better partner, Director Hawkins, to continue to address this need and concern that we have, and we continue to look at that as well to ensure that it stays a priority.
Other concerns that we had was relative to the OT-PT process. I believe they were at one time doing them at the facility. Then all of a sudden there was a move to try to perform that task up in Providence, which to me doesn't sound realistic because of the fact that many of these veterans are in wheelchairs or the mobility is less than 100%. And so can you address what the current policy is, especially now in light of the COVID?
Yes, sir, absolutely. So every resident receives physical therapy if their physician provided it orders for it. No resident will be denied physical therapy. I want to be crystal clear because I know there's some miscommunication regarding that process. If I'm a resident that has a disability rate, federal VA disability rating of 70% or more, then am not subjected to any type of co-pays in that capacity. And that's what got us in trouble in that regard, charging veterans that have a disability rating of 70% or more co-pays or maintenance fees. And we're fixing that problem. Most of our residents have insurance to help them pay for the physical and occupational therapy provided at the veterans home. Billing third-party payers aligns us with the standard industry practice for most nursing home settings in that regard as well. And so it's based upon the orders that are designed for the physician. We also ask our family members to sit in with the physician to talk about PTOT requirements for mom and dad going forward too, because we want them to have buy-in also as well. And also that helps ease some of the angst and the miscommunication that's out there regarding the PTOT policy. Mom and dad was getting PTO on a regular basis. Now I'm hearing a rumor that's not the case. Oh, we got to drive all the way to Providence. Why can't we done that here? We've addressed all those issues, and then we've started that process. But one reason we had to halt it, obviously, because of COVID-19. But rest assured that every veteran that receives physical therapy, no resident has ever been denied physical therapy at the veterans home, sir.
All right. As far as the getting back to those staffing, how many openings do we have at the veterans home in terms of different occupational staffing issues?
So what we're seeing now, because we have an opening for CNAs at the facility, but because of the pandemic, because we are in a deficit in area too, so we have the open spots. For example, CNA, we have open spot, but we don't have anyone to fill it because of the competing requirements for the ability for that CNA to seek work elsewhere in that regard. So that's one of the challenges. But again, we continue to work with OMB and HR to assist us with trying to do active recruit to get folks in those seats in order to fill those positions.
Senator Morgan, you have a question?
Thank you, Mr. Chair. Are we providing it in-house, though, at the time?
Yes, we are providing. We do provide it in-house, yes, ma'am.
Okay, good. Thank you.
All right, I'm not looking at the chat board or anything like that. So if you have a question, please raise your hand. That could be internal, where Director Hawkins could answer, or someone could answer. I'm having enough trouble trying to figure out the hands and moving from there. So, Senator Bell, you have the question, and Senator Lawson.
Yeah, just a very quick follow-up on this. Posting the positions is not enough. If they aren't being filled, I'm concerned that it's simply just a sign that an adequate wage is not being offered and funding is not being offered to pay for CNA training. So people are asking to pull from the existing pool of CNAs rather than paying for the roughly 5-week course required to obtain the certification. So I'm just concerned that there's a level of seriousness. I heard you mention deficit concerns, and it sounds like the lack of money has held back the department from paying the high enough wage required to get CNA staffing during a shortage of CNA staffing.
I'm sorry, Senator. I'm sorry, Senator. When I said the word deficit, I was using it in terms of numbers of CNAs, not a monetary number, but in terms of number of CNAs to fill those positions. That's what I meant by the term deficit. I'm sorry.
So,
monetary association.
What wage are you offering for the CNAs?
I have to I'll get you the numbers to it, but I know for example, regarding the use of agency, we had to increase our hourly wage to $20 an hour in order for us to be competitive. But I will get you the breakdown. I'll get you the breakdown to the committee, break down the number of what their wages actually are. I don't have that number in front of me, but I'll get it back to you.
Okay. Thank you.
Senator Lawson.
Thank you, Chairman Felag. Good afternoon, Director Yarn. As someone new to the committee, I found your annual report very informative. Thank you for that.
Yes, ma'am.
One of my questions sort of goes back to where Senator Bell began. I was just wondering how many residents do you have currently and what the capacity is? And I know you talked about, because of COVID, the the waiting list, and I was just wondering if you could describe what the process will be or the timeline on admitting new residents to the Veterans Home.
So thank you, Senator, for the question. You know, we've started because of our ability to maintain the virus, keep it under control. Again, so we're doing our surveillance tests twice a week. So based on the results, that dictates our ability to do what the next steps are regarding our veteran home, regarding admittance. So now we know for the third consecutive week, we've not had any new cases. So as a result, we've started to increase our ability to start to process to new enrolled, to have new residents come into the facility. And that's critical because, you know, in our facility like this, so we know the waiting list is long, but the virus was a single point factor that stopped us from start the admittance process. And so now, since we've gotten great results from our process, now we're starting to do more so regarding our ability to bring in new residents slowly but surely, because it's a deliberate process from the time till we do to fill out the application to actually calling up the family member or the veteran saying you're now accepting your enrollment to come into the facility as well, because the testing piece, the vaccination process, it's a fluid process in that regard too, but we're trying to do this safely as possible because we're trying to mitigate the virus and we don't want this to creep up on us in that capacity. Regarding our census data, we have the facility is building for a total of 208 residents. 15 which are domicile residents on the second floor. So this is the area that was set aside in partnership with our federal VA partners and state, allow us an area so we have homeless veteran population, we can utilize the upstairs facility as well for those that can be able to self-medicate. Our current census data right now, we're currently at 138 nursing and 1 domicile resident.
I know we have new members here, and previously the veteran home was like a hospital type setting where you walk down a corridor and patients or veterans would be located one or two to a room as you walk up and down one hall and then go to the next row, and it was really not a good setting. Can you just expound a little bit on the pod concept and what we've done in Bristol in terms of the cottage facility and veterans having their rooms and how many to each pod and how many pods we have, so the new members can get a perspective layer of the new facilities.
Yes, sir. And so the old facility, it was essentially it was like a nursing home design. Regarding the new facility, again, so this started back when a veterans wanted to get out of that institutional style way of living to more of a community based. So if you were to walk through it, it'd give you it feels like you're in a neighborhood in a community setting. We have a total of 6 neighborhoods consisting of 32 total with 16 individual pods. So two pods, 16 each, makes up a total of 32. From that, we have 6 neighborhoods. And because of the design of the facility itself, we were able to rapidly set up a quarantine isolation unit. So that way, doing our testing twice a week, so say if Kasim tests positive for COVID-19, I can move out of my existing neighborhood into a dedicated quarantine and isolation neighborhood as well. And then we monitor the situation from there. As I continue to be tested, once I test negative, I'm getting cleared, and I can move back to my other neighborhood that I came from.
Very much. Let's move on to the Veterans Memorial Cemetery. I guess the first question, you give a nice synopsis of how many ceremonies we have. What type of COVID restrictions do we have on those cemetery ceremonies? Do we allow?
So what I think somebody has a background noise. All right, so what we do, we utilize that in conjunction with our Rhode Island Department of Health to make the guidelines and make what you. Senator, Chairman, I think you're muted, sir.
I just want to make sure everybody else is muted.
Okay, so regarding your question, sir, regarding the cemetery, so we're following Rhode Island Department of Health guidelines as pertains to the governor's executive order in terms of how many folks can get together in a certain venue. Regarding the restrictions, if there's 5 to a party, then we add 5 to a communal service. If it's 10, so on and so forth in that regard as well. Because we're in the winter months, we do not authorize graveside burials, because what happens is over time it could potentially